Hi, my name is Jenny Johnson, and this is Sadie, and she's going to be my patient for my health assessment, full body assessment. I had Sadie put a gown on. She also emptied her bladder prior to this exam. I did a full set of vitals, and I also had her vision tested with the Rosenbaum for her near vision, and then the Snellen for her far vision. First of all, I'm going to look at Sadie's head. I'm going to make sure that it's symmetrical. I'm going to feel her scalp, make sure that there's no lumps, bumps, any lesions, that her scalp moves freely. I'm also going to check her hair to make sure her hair is not too fine or coarse, that's not brittle, that it's nice and shiny. I'm going to look at the texture and the thickness to make sure that it's not too thin, that she doesn't have spots where she's lost hair, like with alopecia. Next, I'm going to look at her facial. So I'm going to look at her facial features, just making sure that they're symmetrical, that there's no drooping to either side of her face. I'm going to look at her skin, make sure that her skin has no sores, no bruising, and then I'm going to also palpate her facial bones. So I'm going to feel across her forehead here, just checking to see if she has any pain. I'm going to check her submandibular joint, see if she has any pain with me pushing. Do you? No. Any clicks or pops in that joint. Next, I'm going to check some of her cranial nerves. So Sadie, I'm going to have you first wrinkle up your forehead. Okay, I'm going to have you smile, clench your teeth, stick out your tongue, puff out your cheek. Okay. I'm also going to check her sensation. So I'm going to have her close her eyes, and I want you to tell me if you feel this.
Yes. 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 Yes.
Okay. Next, I'm going to look at Sadie's eyes. I just want to make sure that she has, that her eyes are, that her lids are without ptosis, that she has no flaking, that her eyebrows are evenly dispersed with her hair, that her eyelashes are forward, and then I'm going to also look at her lids. I'm going to make sure that they're nice and pink, that her conjunctivas are clear, her sclera is nice and white, she has no drainage or erythema within those areas. During the palpation of her eyes, I was also going to feel her lacrimal apparatus, and also look for any swelling around her eyes that would go with any kind of diseases. Next, I'm going to do some visual fields with Sadie. So first I'm going to look at her pupillary response before that. So I'm going to have you look forward, Sadie. Then I'm going to shine a light into her eye, just making sure that her pupils are reactive, that they're equally round, and that they're reactive and they're also accommodating, so hold they're doing that. Next I'm going to do the cover test. So I'm going to have you cover one eye, okay, and uncover it. And while she does that, I'm just looking and watching to see if there's any kind of a nystagmus in her eye or some involuntary movement of her eyes. And I'll have you do it with the other eye. And I do not see any of that. Next I'm going to do her 6 fields of cardinal gaze. So I'm going to have you stare at my finger. And I'm going to go up. And I'm just making sure that she's able to follow my finger, that she doesn't have any involuntary jitters to her eyes, any nystagmus, and that her ocular muscles are able to, her eyes are able to move in those fields. Next, I am going to do her a peripheral vision test with Sadie. So I'm going to have you look at me, cover your eye, and I want you to tell me when you see my finger.
See it. See it. See it.
Okay, let's do your other eye.
See it. See it. See it.
And that turned out nicely. Okay. Next, I'm going to go to her ears, just making sure that her auricles are nice and nice, without swelling, any redness, any pain while I'm palpating them. I'm going to test her hearing by doing a whisper test. I'm going to come around to the back of her. Go ahead and plug one ear. And I'm going to whisper a word and I want you to repeat it.
Banana.
Now let's do the next one. I'm going to next check her conduction. So first I'm going to do bone conduction, and this is with the Weber test with a tuning fork. So I'm simply just going to hit this fork, set it on the top of her head, and I want you to tell me if you hear it in both ears, one ear, or your right ear, okay?
Both.
Okay. Next I'm going to test for her airflow versus the bone conduction. So I'm going to hit this, set it on her mastoid process. Tell me when it stops vibrating.
Stop.
Tell me when you stop hearing it.
Stop. Stop.
And that's just testing if her, whether her air conduction is better than her bone, which it should be her air, and it was. Next I'm going to look at her nose. So I'm going to look on the outside of her nose, checking for any lesions, any sores on her nose, making sure that it's midline, that her septum is not deviated at all, which it looks good. I'm going to look up inside of her nose, look at her tuber, making sure that her hair is easily or evenly dispersed in her nose, that her mucosa is nice and pink, that there's no drainage present, that there's no polyps noticed inside of her nose. I'm just going to have you do a clearance test. Just plug one side of your nose and the next, and you don't feel like you have any plug that you can breathe well through your nose. Next, I'm going to check her mouth, and so first I'm going to look at the outer lips, making sure there's no cracks, making sure they're nice and moist and pink, and the corners especially, making sure that there's no sores, cracks in the corners of her mouth. I'm going to have you open up. I'm going to look at her teeth, making sure that they're nice and white, that she doesn't have any decay, that they're not missing. Her gums, making sure they're nice and pink, that there's no bleeding, and that they're not recessing at all. While I'm in her mouth, I'm going to look underneath her tongue, on the sides of her tongue, making sure there's no sores or any precancerous sores or lesions in her mouth. Checking her cheeks, the roof of her mouth, her soft palate, and also her tongue, making sure they're nice and moist, so there's not cracks, dryness, there's saliva production, and most of all that there's no lesions or sores in there. I'm going to have her stick out her tongue, and I'm making sure that her uvula is midline, that her tonsils are not too swollen, that there's no exudate noted on them, that her uvula is midline. I'm going to have her say ah, and when she says ah, it's her soft palate lifts and her uvula stays midline, so that's also checking some cranial nerves. I'm also going to check her gag reflex with this, which she has, so that's all intact. Next, I'm going to check Cece's neck. So I'm going to first check her glands. First, I'm going to check, I'm going to look at her neck. So I'm going to make sure that everything's symmetrical, that she doesn't have any jugular distension, that her trachea is nice and midline, that I don't see any masses from her thyroid, perhaps a goiter, or any lesions front and back. Okay. Next, then I'm going to check her lymph nodes. So I'm going to check first her preauricle, then we'll do her postauricle, submandible, her tonsillary, her occipital, superficial cervical, her postcervical, and then her supraclavicular. And I'm just checking to see if any of those are firm, that if there's any nodules that they move, that they're easily movable, that she's not having any tenderness in these areas. I'm going to palpate her trachea, just making sure that it's midline. I'm going to have you swallow, make sure there's no tracheal tugging. I'm going to feel her thyroid, feel if there's any nodules or tenderness in there, which I do not feel. I'm going to check her carotid pulses. And they're nice, and they're not bounding, or I don't feel any frills. I'm also going to listen. First, I'm going to listen with my bell for her carotid. I'm going to hold your. And then I'm also going to listen to her thyroid. And with that, I'm just listening to see if she has any vascular abnormalities in her thyroid, which you should not hear. And then also making sure with her carotids that there's no brewery noted in her carotids. Next, after this, I'm going to check her arms. I'm going to feel her joints, look at her joints. So I'm just making sure there's no swelling or redness, that she's got any crepitus in there. I'm looking at the temperature, feeling to make sure her arms are nice and warm, that her skin is nice and soft, that there's no lesions, abnormal bruising, that her hair is dispersed evenly on her arms. I'm going to look at her fingers, making sure that her nails are nice and pink, there's no cracking or breaking of her nails. Her capillary refill is +2 or -2, so she's got good capillary refill. I'm going to feel her radial pulse, which is not bounding or sluggish. Feel her brachial pulse, which is also normal. Then I'm going to go to her back and inspect her back, or her posterior of her chest. Just looking, inspecting the skin, looking at the contour, making sure that she's got even rise and fall when she's breathing. I'm also going to look at her costovertebral area, which I'm going to palpate first, just noting any tenderness in these areas, and then also doing percussion. Do you have any pain in here with me?
No.
No. Okay. Next, I'm going to inspect her lungs. So first I'm going to go from her back, since I'm already on her lungs. So I'm going to first look at her expansion. I'm going to make sure that it's evenly rising, falling, that her rate is good, that she's about 16 right now, so she's not having difficulty breathing or anything like that. I'm going to check her expansion of her lungs. So I'm going to go about the 10th intercostal space. I'm going to take a nice deep breath. And I'm just watching for a nice rise and fall, that my hands are equally going up on each side, that she has no off movement with her chest. I'm going to percuss her lungs now. So I'm going to start from the top here. And I'm just making sure that she's got a good resonance, that there's no dull sound, which would show like a consolidation or fluid. And she's got nice resonance in her lung fields. I'm also going to do diaphragmatic excursion. So I'm going to have Sadie just kind of lean forward a little bit and kind of go down. I'm going to percuss from the top here. And when I hear a change, I'm going to mark that. And go out. And then I go from this mark until I hear another. And this should be about 3 to 5 centimeters, which is okay. Since I'm over on her back, I'm also going to do tactile fremitus. So I'm going to have you say 99, Sadie. I'm going to touch her with my palms of my hands.
99.
And I'm just feeling for good vibration, which means that her lungs are clear and she doesn't have any fluid that's causing it not to go through her lungs well. I'm also going to percuss her arms up to the side, please. Percuss her lateral sides here. Also listening for resonance. And then I'm also going to listen, auscultate her breath sounds. Okay, breath. Okay. All right, and then I'm going to have you turn around. Thank you. And now I'm going to assess her chest, her anterior of her chest. So I'm going to look, making sure that her trachea is midline, because with any kind of issues with her chest or her heart, you could see a shifting of her trachea. So making sure that her trachea is midline. I'm also looking at her skin and making sure it's symmetric. Also making sure that her breathing is symmetric, that she's got a normal rate. And then I'm going to also look and see if I can see any pulsations or any heaves. So I'm going to feel first in her precordium and feel for any thrills or any heaves on each of the borders, and I do not feel anything. I'm going to listen to her lung sounds here first. Take a breath. Okay. And she has nice resonance, and her breath sounds sound clear, and she's got good resonance with her lung sounds. I'm going to now listen to her different heart sounds. So first I'm going to listen to her aorta, which is in her right second intercostal. And then I'll go over to her pulmonic. And her Erb's point. And her tricuspid. And then her mitral valve. And those all sound well. I don't hear any murmur or extra sounds, clicks, or anything like that. It sounds, she's got a good S1, S2. Okay, next I'm going to go into Sadie's abdomen. So I'm going to have her lay down. And first I'm just going to have her pull. Okay. So first I'm just going to assess her abdomen. Yeah, I'm just looking here for the contour, looking to see if she has any hernias, that there's any swelling, that I see any pulsations in her abdomen, that her skin has no sores or bruising. I think I'm going to go over on this other side here so you can see me better. Next I'm going to listen after looking and making sure that her skin and her contour of her belly looks good. I'm going to listen to make sure she has 4 bowel sounds. Make sure that they're active, that they're not hyper or hypo. And you listen for about 2 minutes up to 5. Okay, then I'm going to listen to her aorta. Her renal. Her iliac. Then her femoral. Okay, next I'm going to do some percussion. So I'm first going to just go over her belly just to, first of all, hear the tympani. The tympani is what I should hear over her belly. Dullness would mean that there is a consolidation or a mass. Next, I'm going to check for liver borders. So I'm going to go start up here, actually up into her lungs where I hear resonance first. And I'm going to find her top of the border of her liver. Right here is where I hear it change. So I'll mark that. And I'm going to start down here. And then I hear a change about right here. And if you see my marks there, 3 to 5, or 6 to 10 centimeters apart. So that is about 6 actually right there. So next, I'm going to do some light palpation. Actually, first I'm going to listen for her spleen first. So I'm going to have you take a couple breaths in there. And listen for tympani. I'll just do it. And if you hear a crest, you should hear tympani sound all the way through. I'm going to do some light palpation here first on her stomach. Just feeling for any lumps, any bumps. I'm going to feel right in the center here for the aorta. See if you feel any pulsations or any kind of a thrill feeling. Have her take a deep breath, and I'm just going to blow it out, and I'm just going to feel for the border of her liver, which it doesn't feel like it's inflamed. Over here, I'm going to feel for her spleen, so I'm just going to place my hand underneath and kind of push up, and that allows me to kind of feel, which you should not be able to feel her spleen. It is only able to be felt if it's 3 times larger than it should be. I'm going to go on the back of her flank area and kind of push up. And this is just checking for her left kidney. Any pain at all?
No.
And then checking her right kidney. And there's no pain? Okay. Now I'm going to do some deep palpation here. I won't go too hard because your stomach kind of hurts already. So, feeling for any lumps, bumps, any tenderness, any rebound pain. I'd see if there's any wave, like a fluid, if she had fluid in her belly, which her belly is nice and flat. I'd have you strengthen your muscles up, just feeling the musculature of her abdomen, making sure that it's nice and tight and firm. She's got good abdominal muscles, which she does. Next, I'm going to check her legs. And so I'm going to just go down her legs, looking at her, the mass, the strength of them, making sure that her muscles are nice and firm. I'm going to look at the hair, making sure that the hair is distributed evenly, that her skin is nice and pink, that it's warm, that she doesn't have any lesions or sores on her legs. I'm going to look for edema, if there's any swelling at her ankles, and see if she has any pitting edema. I'm also going to check for pulses here, so I'm going to check for her tibial pulse on both sides, making sure that she's got good pulses. Same with her pedal pulse, and then also her popliteal, and I would do that on both sides. I would look at her nails, making sure that they're nice and pink, that they're not cracked or peeling, that she's got good capillary refill, which she's got less than 2, so that is good. I'm going to check her, do a sensation test on her. So I'm going to do a soft and then also a firm. So tell me if this is sharp or soft.
Sharp. Soft. Sharp. Soft. Soft. Soft.
I'm going to just going to check the bottom, see if she has got the flare with her toes. I'm going to have her sit up. We're going to do the muscular system now. So first I'm just going to look at her tone, making sure that she's got no atrophy, that everything's even. And actually I'm going to have you swing around because I think the camera's not seeing me here well. So I'm going to look at her arms, her muscles. I'm going to do reflex checks. So first I'm going to do the knees, just making sure that she's got good reflexes. The Achilles tendon, and then also her brachial. I'm going to check the strength of her muscle groups. So I'm going to have you hold your arms out, Sadie, and I want you to push up, and then I want you to push down. Okay. And then if I can have you lay back down, I'm going to look back at your leg strength. So I want you to, oops, you can't see me, sorry. Push down with your toes, and then pull up. That's just checking the strength of her legs. So I'm going to have you stand up right here, Sadie, right in front of the camera here so they can see, and turn around. So now I'm going to check her cervical and her lumbar spine. So I'm going to make sure that it's nice and straight. Have you bend forward a little bit. Making sure there's no kyphosis or scoliosis, that she has no tenderness down her cervical spine, and that she is freely able to move. Okay, and that concludes our physical examination. Thank you very much.